Good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas. You're watching COVID-19 World News. In this presentation, we are going to see if we can predict when will this current COVID crisis will end in Europe and in the United States. What have we learned from China and Italy, and how we can translate that to predict what's going to happen in the rest of Europe and the United States. Before that, let us collect some raw data. As of March 20, 2020, there are approximately 255,305 cases all across the globe with coronavirus infection. This coronavirus has involved more than 163 countries with more than 10,400 deaths. I want you to keep this graph in your mind and imprint this graph, because we are going to be coming back to this graph not only in this presentation but for the next several weeks to give us some guidance as to where we are in this graph and what can we expect to happen in the coming weeks. Now, here are the numbers from yesterday. There were 235,400 cases on March 19th, and as you can see, and there were 9,785 deaths. And if we go back to the previous slide, the cases jumped to 255. So there has been a dramatic increase in the number of new cases detected all across the globe, along with a continued spike in the number of deaths related to the coronavirus pandemic. Now, here is a chart showing raw numbers, and these numbers are constantly changing from hour to hour. Let's focus on 4 important countries so that we can come to an understanding of how to use the data from these countries to predict where we are in this epidemic. When do we think this epidemic is going to conclude? First, China. China reported more than 80,000 cases with 3,248 deaths. The next country with the largest number of infected patients with the coronavirus is Italy, which has 47,000 plus cases with 4,000 deaths, which surpass the number of deaths in China. So Italy has twice the rate of death, which is close to 8%. And this has been largely attributed to the older age population and also to late implementation of quarantine and crowded areas. Now let's move on to Germany, which is an interesting country, which has 18,794 cases and only 53 deaths. Explanation from the German health authorities is that they have an extensive network of laboratories which are managed nationally because they have a national healthcare system, and they already had these tests available even before the pandemic hit the German country. Even though they have been able to identify most of the patients with positive coronavirus, they still have not been successful in fully containing the virus spread, because this virus has spread into practically every province in Germany. But what is more important is we want to see when the spike in the number of new coronavirus detection reaches the peak, reaches a plateau, and begins to show the decline. Then we're going to look at United States, which has 16,500 cases with 223 deaths. When we look at these raw numbers, it is impossible to make any sense as to where do we stand in this epidemic? At what part of the cycle are we in this epidemic, especially in Italy and in the United States? And what do we expect is going to take to change the course, flatten the curve, reduce the number of people admitted to the hospital, reduce the complications, reduce mortality, and conserve medical resources? Now, let's look at the number from the United States. We have 14,500 plus cases and 210 deaths, and the virus is present in all the 50 states of the United States of America. Whereas Germany, which we already talked about, has 18,300 cases with only 53 deaths. Let's keep that in mind because we are going to be looking these numbers in a graphical form, which will make a lot of sense. And now, as I was talking about graphical sense, here is a graph which should be imprinted in the eyes, minds of every medical professional, because this is the roadmap of the epidemic of coronavirus in China, including the Hubei province. Let's pay attention to this red and cyan color graphs to begin with, or I should say Hubei, which is the yellow graph. In China, the epidemic followed what is known as the FAR curve, FARR, or simply I would say it follows the bell curve. We have an uprise in the number of new cases of coronavirus. It reaches a plateau and then it gradually decreases to a point where it disappears. We see similar patterns year after year in the incidence of common flu all across the world. Similar patterns were seen in case of SARS, MERS, and any other epidemic breakouts you can think of. Okay, let's look at this particular coronavirus pandemic with reference to China with and without Hubei province. It started somewhere in the middle of January. Then there was a sudden spike in the number of new cases detected each day until it reached a peak of more than 10,000 total number of cases all across China. But to a large degree, they followed a very predicted path of a sudden uprise in the number of active cases reported. Then it reached a plateau. To make more sense out of this in terms of how long did it take to reach the peak, how long did the plateau last, and how long did the decline last, I have put some lines here. So let's look at that. From the beginning of this epidemic to the point where it reaches a peak, for example, in China, except Hubei, which may be a more practical graph to look at, it was approximately 10 to 12 days. The plateau of this curve lasted for 6 to 8 days, and the downslope of this epidemic lasted from 30 to 40 days. In other words, the whole epidemic in China lasted for approximately 50 to 60 days. But you see, this does not include the incubation period, which can be 2 to 3 weeks, and we have no way of finding out when the incubation period started, especially if we are applying this principle to other countries which are just beginning to see a rise in the number of active coronavirus infections. So let us keep this graph in our mind, these time intervals, and see how it correlates with the countries we are interested in exploring. So here, let us start with Italy, because Italy has the second largest number of coronavirus cases, which is approximately 41,000 with a mortality which is well over 4,000. And when we translate this into a graphical form, then we begin to see some similarities between the graph in the Italian population and the Chinese coronavirus epidemic. In Italy, it started somewhere between February 23rd and 25th. However, they did not institute a complete lockdown almost after about 10 days. And after that, we see a gradual increase in the spike, which was not as steep as we saw in the Chinese population. But nonetheless, the quarantine might have helped to a certain degree to flatten this curve. Except for this spike on the 19th, if you look at this graph, you may begin to think, okay, we are almost reaching the plateau here, and hopefully maybe we'll begin to see a decline. But that was not the case on the 19th, when there was a sudden surge in the number of new cases detected in Italy. So basically, we have a slightly flattened curve, but we are anywhere in sight of a peak or a plateau. So that's where Italy is right now, until we see leveling of these new cases and then a slow decline. We cannot predict how long the cycle is going to last. Definitely it is going to be longer than the 60 days we observed in the Chinese population. Now let's look at Germany. Germany is an interesting country because even though the German curve looks very similar to that of the Hubei province, what is interesting is they have the lowest mortality, and still they have the most widespread virus all across the entire country. But anyway, let's get back to when it started in Germany. In Italy, we said it started between February 23rd and 25th, and in Germany, so this has started 1 week after it started in Italy, and the numbers are practically going up pretty steeply, and it has leveled off in the last 2 days. We have to get the numbers from today, and we have to see, are we still in the upslope of this bell curve, or if we are going to reach a plateau. If these numbers level off and then begin to decline, then it may give us some hope that we might have reached the peak and we may be on the phase of plateau. And again, as we can see, the cycles in Europe are lasting longer, and the number of cases are actually more than what was observed in the Chinese population, and we have no sight of this increase in new cases reaching the tip or the plateau. That's German story. Now let's look at the United States. In the United States, it started around March 5th or 6th, the appearance of the first cases of coronavirus. And here we are seeing a pretty steep uprise in the graph, similar to what was seen in Hubei province and also in China altogether. Again, this has lasted for almost 14 days, and still there is no sign of whether we have reached the peak or not. But in contrast to Italy, let's go back to Italy. In Italy, the graph was more gradual and flattened, whereas in Germany and in the United States, they seem to be on a steep increase, and we are nowhere close to predicting what part of this upslope curve we are in the United States and in Germany. Until we reach a peak and a plateau, there is no way to predict how long this cycle is going to last. So let's go back and summarize what we have learned. We use the graph from Chinese experience of this coronavirus epidemic, both in the province of Hubei and in the rest of China, where the cycle lasted between 50 and 60 days. It had a pretty steep upstroke, a plateau, and a gradual decline, which is seen more often in places where the healthcare facilities are less than adequate to the population size. Whereas you see a flatter curve in countries where the healthcare resources are able to meet the demands of an epidemic. Okay, to summarize, in China, it lasted for 50 to 60 days. Based on that, we should expect to see similar curve in the Italian population by April 3rd. But since this is a much flattened curve, it may last for much longer than the 60-day period we observed in China. And let's look at the United States. In the United States, we have seen a sharp upstroke in the number of new cases compared to that upstroke in the United States, similar to what was seen in China, Hubei, and rest of China. But we have no idea where we are in terms of this upslope of this epidemic in the United States. But nonetheless, it does tell us several things. Number one, we are seeing a steep rise in the number of new cases. And this particular spike may be related to the increased number of testing kits made available all across the United States. Let's hope so. If that is the case, then the rise may be not more than what you would expect to be. It also tells us that we are still in the upslope of this curve. To me, I think what is more important is to realize how many patients are admitted to the hospital, because that number is going to be most crucial in terms of telling how many people are sick and how much resources they are going to need. The overall number of new cases does help us because 80% of the people who test positive for the coronavirus are asymptomatic or mildly symptomatic, and they don't need hospitalization. So based on those numbers, we can sort of extrapolate how many patients may need hospitalization. If 20% of the patients need hospitalization based on the Chinese data, then the total number of cases would be quite useful as long as these numbers stabilize after the coronavirus testing is widely applicable in the United States. So that's where we are, ladies and gentlemen. Thank you so much for watching this. Please do subscribe to our YouTube channel, and we will continue to produce hopefully smaller videos explaining many aspects of this COVID-19 pandemic 2020. Please do subscribe to our YouTube channel, and we will see you next time. I am Dr. NIK NIKAM.